So by way of introductions, guys, my name is Rachel. I have the pleasure and the privilege of being the Director of Studies for Clinical Medicine here at Homerton College. Um, so the way I'll talk a little bit more about this later, but the way it works is your Director of Studies essentially provides additional academic support towards your study time. So briefly about me, I studied at Bristol University with something called an intercalated degree, which I'll talk about a little bit more in medical ethics and law. And then I went on to specialise in equine practice. So I completed a postgraduate in equine and had a very, very happy 6 years as an equine practitioner, especially doing a lot of orthopaedics and a lot of teaching within Cambridge University. And then 2 years ago, it's actually my 2-year anniversary in my new job tomorrow, but 2 years ago, I made a transition into wildlife practice. So I now work for RSPCA Eastwinch, which is one of the biggest wildlife rehabilitation centres in the UK. We're the biggest one for seals, anyway, seal pups. So I split my time between there and Homerton. So I've done all sorts of sort of small animal, equine, and wildlife practice and charity practice. So if you have any questions as we go through, as Victoria said, just pop them into the wee question box. And yeah, hopefully my diversity of practice can allow me to support a whole range of interests. So we also have a lovely Dr. Liz Hook. So Liz Hook is a specialist human doctor. She only does one species. So she is a histopathologist who sort of subspecializes in a lot of pediatric neoplastic processes. So she oversees the preclinical part of the course, which I will explain in more detail now. So without further ado, if we could go to the next slide, Victoria, that would be amazing. Thank you. So why veterinary medicine at Cambridge? I'm absolutely not here to tell you that all the other vet schools are terrible and you will only have a good time at Cambridge. And if veterinary is what you want to do, you will have an amazing time, whatever university you go to. It's an incredible career. It's an incredible undergraduate degree. Or if you're coming at it as a mature or postgrad student as well, it's just an incredibly fulfilling, challenging, fun degree course where you will learn so much about yourself and you'll make some incredible friends and incredible relationships through it. So I promise you'll have a lovely time, whatever university you choose to go to. But seeing as you're all here today, I will certainly with glee and joy talk about why Cambridge is quite so fantastic. So as the lovely Victoria said, we do offer a lot of financial support. So we'll talk a little bit more about the placements that you have to do while you are at that school. It's a requirement of the Royal College of Veterinary Surgeons. It's not a sort of exclusive Cambridge thing. But we are, I believe I'm still correct in saying, of all the new vet schools included, we are still the only vet school to offer payment to our students while they're on those placements. So vet school, unfortunately, does incur a lot of additional costs. For example, expenses traveling to and from placements, to and from farms. Quite often you're going to be working in sort of a rural area for a couple of weeks of placement and then in a city where you don't have accommodation. We're really fortunate here at Cambridge and specifically at Homerton College, where we offer not only financial support for those sort of obligatory placements, but we have a wonderful financial tutor as well, who's called Diru, who has many decades of experience in accountancy, who can really help provide a lot of financial support and advice. Additionally to that, we do have grant funding applications. So we've been exceedingly lucky where I've had students go to Thailand for spay and neuter clinics in their clinical years. I've had students go and look after sloths in Costa Rica, which I was pretty jealous of, but and we've had students go to see sort of safari and big game practice as well. So we do offer these incredible financial support systems. Homerton really prides itself on inclusivity, and that is one of the many reasons that I'm incredibly proud to work here. But one of our central tenets is inclusivity and widening participation, and anybody who wants to have a fulfilling career in veterinary should be able to do that, regardless of our own sort of financial and home situations. So we're incredibly lucky to be able to offer that financial support. We've got really small student numbers, so the max at present that we have in a year at Homerton is 3 students. Typically lecture sizes are sort of under 75 people, under 75 people in a year. And then you will also have these small group teaching opportunities as well, where you'll only have maybe 2 or 3 people in a cohort. So that is unique to Cambridge. It's practical from day one, which we'll want to talk a little bit about. And we're also very lucky to have a hospital on site. So we have small animal, equine, and farm facilities on site, as well as clinical and anatomical pathology. And we've got a huge imaging department that's recently got an MRI machine, which is very exciting. So there's huge scope to do a lot in situ with clinicians who really care about teaching and really want to invest in you and your learning opportunities. We have excellent outcomes for graduates. So as Victoria said, on the whole, the university produces incredibly employable graduates. Lovely thing about here, as with other UK vet schools as well, is you will qualify as what's called omnicompetent, which sounds like a very grandiose term, doesn't it? But it basically means that regardless of your particular interests at that time of graduation, if you qualify and are really passionate about farm animal practice, but in 5 years' time, you really, really want to give small animal practice a go, you can do that with your degree. So there's a lot of flexibility that comes with the vet course. I have a lot of friends from my time at university who now work as government vets. One of them is a welfare advisor for Waitrose and their meat and egg produce. Loads of friends in small animal practice GP, loads of friends in farm GP, loads of friends in equine, and then specialists as well. So it's such a diverse career that if you're interested in science, interested in animals, and like talking to and working with other people, I would really encourage you to consider a career in veterinary medicine. Obviously, I'm incredibly biased, but the other wonderful thing about Cambridge, and again specifically Homerton, is we do have these fantastic college environments. So it sort of fosters these friendship groups where you can live with non-vets, for example. So a lot of the veterinary schools, which are campus universities, you will live and study with vets outside of the city. And that really suits some people. That for some of you, you'll be like, oh, I love the sound of that. That sounds amazing. But if you want this kind of world-class scientific environment, as well as this collegiate system, whereby you can live with people studying engineering, history of art, music, English, natural sciences, any other amazing courses. And Homerton's very lucky in that we do offer every single course across the board, which is pretty cool, I think. And if you would prefer that to feeling like you were kind of at vet school, studying there, living there, breathing there, then certainly the Cambridge system is one to consider. So we can move on, Victoria, if you don't mind. Sorry, I feel bad making you my clicker now. So Cambridge is over 800 years old. We've been teaching for a very long time. And then next slide, Victoria, please. Thank you. So what's really amazing about the Cambridge course is you'll have this really in-depth learning of what we call basic veterinary sciences. Not basic because they're easy, but basic because they are fundamental, right? So there's a lot of things that we refer to in clinical practice, such as first principles. For example, if you know how a kidney works, you will know why cats who develop renal disease also develop blindness, for example. And those are the kind of things, that kind of physiology and pathology teaching are things which will underpin your entire veterinary career. And what's fabulous here is that we have this kind of preclinical clinical divide. So next one, Victoria, please. We've got these regular small group teachings in college. So this is again unique to Homerton. So for example, I supervise the vets for veterinary anatomy and physiology. So they go to their lectures and they learn about the theory of it. They then go to a practical dissection where they'll get to actually be hands-on and see that the textbooks do speak the truth, and the muscles are indeed where they claim to be, etc. And then what we'll do is we'll have a supervision group. So I have three wonderful first years at the minute. And we will go through, for example, I will give them more of a clinical orientation on those. So, for example, in their cardiology teaching, they would have two lectures on the sort of embryology of the heart, how the heart works, all the structures of the heart that they should be aware of. They'll then go to dissection and be able to see that for themselves. And then we'll do a college supervision where it's just me and them, which I mean may sound awful to you, but I do tend to bring biscuits. So we will go through some of the more clinical aspects. So, for example, I'll play them recordings of different types of murmurs or show them things like echocardiograms to see what a normal heart looks like, see what a pathological heart looks like, and just to try and marry all that theoretical physiology and anatomy together with the pathology. So that is unique to the Cambridge system. And you also have this amazing opportunity to explore your own interests in your third year. So when I referenced it at the start of this presentation about intercalation, that's essentially that you take a year out of your veterinary undergraduate course to pursue a year of something else that you're passionate about. So a lot of students will intercalate in zoology, for example. I have one of my 5th years intercalated in zoology and did a project on the ecology of wild wolves. One of my students who intercalated in natural sciences has done, she's in the middle of finishing her dissertation on different types of monoclonal antibodies, so different types of therapeutic agents from quite a theoretical human-based lens, and how that's applicable to veterinary. Other students will intercalate in history of political science, or a history of science, sorry. If they're, for example, interested in, say, you're studying philosophy or history or English at the minute, and you think, oh, actually, I'd quite like to do a more humanities-based subject, and there is scope to do that. So I think that's a really brilliant way to expand your interests outside of veterinary. Equally, if you have a very, very focused goal, for example, you really want to be a surgeon. I have one of my students intercalated in natural sciences, sort of subspecializing in surgical and radiographical anatomy, and we did a project together looking at skull fractures in anseriforms. So anseriforms are sort of ducks, geese, swans. So we basically went through a whole case series of skull fractures that I had in clinic, and she was able to put that together for her dissertation project. So there's loads and loads of different opportunities within that third year. So we do have a practical focus. From week 1, basically, you will have the opportunity to get hands-on with animals. We have a teaching herd of ponies. We have practical and clinical skills lab where we really scaffold that learning. Because obviously it's quite intimidating, right? I don't know if any of you have been on much placement already, but I remember I found it quite scary going on to placement, and you'd have some, incredible nurse or incredible vet who was like, oh, do you want to take this blood sample? And you were like, well, yeah, obviously I do, but this is also someone's dog or someone's horse or someone's cow. So we have these fantastic clinical skills labs where basically you can go and scaffold that learning and learn on a fake leg, for example. So it'll be a model with a little fake vein going through it, and you can practice. And that goes the whole way up to, setting up anesthetic machines, to suturing, to intubating patients. So it's a really fantastic opportunity. And we also have our own farm on site, so you can do lambing on site as well. So these are just some examples of some of our wonderful facilities and some of the practical skills that you will learn in a very safe teaching environment while being taught by very experienced clinicians. So science, as I said, you have that opportunity to intercalate. We've got 800 years of education. We have an incredibly strong natural sciences department, incredibly strong zoology department, and that real focus on sort of scientific, excuse me, principles underpinning your entire time as a vet make you incredibly employable if you get to the end of your 6 years and you think, do you know what, that was really interesting, but I actually don't want to go into practice. And you will have these incredible sort of research experiences as well. So as Victoria mentioned about sort of collegiate system as well, this sort of idea of the Cambridge experience is really nice. So you can get these varied social groups. Homerton really prides itself, as I said, on sort of inclusivity and diversity, and it means that you'll meet some amazing people from all around the world, all around the UK, all studying different subjects, all with different backgrounds. And I just think we really build and foster that cultural competence from quite a young, early stage, which I think just makes your life a whole bunch more interesting. We also at Homerton and as well at the university on a whole have a huge remit of clubs and societies. So we have this huge sports hall, which is actually on the same site as the clinical vet school, which is quite convenient. And as well, we have a gym on site. We have music facilities here. We have a super active Homerton College Music Society, HCMS. And then there's things like swimming pool, not on site here, sorry, from a university, and there are all sorts of rugby pitches, cricket pitches, hockey pitches, football pitches, pick a pitch, we probably have it, and all sorts of different music groups, all sorts of different sort of performing arts, sport. We have things like a matcha tea society here, so I can promise that whatever you're into, there is a club for it, and if there isn't, you're super welcome to start one, and you will be very supported in doing so. So next slide. So as I mentioned earlier, we do have a teaching hospital. So we don't have what's called a distributed system. So some of you who are sort of further along your application perusals may be looking at different vet schools. And for example, the distributed system outsources to external providers, so private practices. This does come with a lot of advantages sometimes in terms of you have a wider caseload and you get to see practice as it is, right? But the downside to this is you're also sometimes a sort of fly in the wall in a very busy corporate practice, whereas having a dedicated teaching hospital means that we have a smaller caseload. We also have clients who come to us and use us because they like that we're a teaching hospital, right? They like that we have small groups. They like that we have sort of accountability towards the students. They like when I used to work at the equine hospital before I went into wildlife, and I had clients all the time be like, oh, I love that you explained that to the student, because that meant that then I was part of a conversation as well. So we tend to have really nice clients who pick Cambridge University because they like the Cambridge environment and they like feeling like they're supporting students. So lovely. And then, as I mentioned earlier, Cambridge Vet School is very small. So typically we have about under 75 people in a year, which means you have under 75 people in a lecture. Veterinary is an incredibly resource-heavy course, which means that we have a lot of required facilities, right? So we have these huge clinical skills labs, for example, but for your anatomy and physiology teaching, you will be doing a lot of dissecting, for example. We have histopathology laboratories. We have a whole anatomical pathology suite on site where we can dissect. I believe I was once told we have room for 2 elephants in the freezer, but don't quote me on that. It might just be 1, but it's massive anyway. And we do get this sort of weird and wonderful off the back of that. And because we have these small groups, it means you're not sort of fighting over resources. So there's plenty to go around. And by plenty to go around, I also mean, teachers and mentorship as well. So we are near the city, and I do think this is something that I'd really encourage you all to think about. If you have a really good think about it and you're like, actually, no, that doesn't appeal to me, then there are other vet schools that do it very differently. But if you like the idea of being close to a big busy city where there's 1,000,001 clubs and societies and everything is cyclable or busable, I would really encourage you to think about applying here, because when I started working here, I never thought that I would be able to be an equine vet and live in a city. So it is something to consider, but we are really close, and that there's no requirement for you, for example, to have a car. whereas in other vet schools there is. Now that might appeal to you. You might be like, actually, I like the idea of being out at like when I was at Bristol, we stayed at Langford, which is sort of in Somerset. Like you might love the idea of sort of being close to the Mendips, and that might be right for you, absolutely. But if you like the idea of being in a big, busy university city in the heart of it, then definitely do consider Cambridge. But do think about it in your application. Do think about it whenever you're looking at different vet schools, because they all have something different to offer. What we have to offer is that we are near the city. So if that appeals, then definitely pursue an application. And then, yeah, as I've sort of already said about financial support. So in general, actually, our accommodation costs haven't undergone the same degree of inflation as anywhere else. We do have these bursary schemes. I am yet to have an application rejected. So whatever my vet students have put in applications for, whether that is stethoscopes, whether that is covering the cost of some amazing opportunity they've got where they want to go to the Abu Dhabi Falcon Hospital or something like that. And that is something that we've always been very keen to encourage and support. So do consider on top of that, there are also things like hardship funds. There are scholarships as well for different sports, different music societies, and we do subsidise EMS as well. Lovely. So really broad overview of the course substructure, and I'm really happy to answer any more questions about this. But basically, you will study in your first 2 years will be preclinical veterinary medicine, and we call that part 1. And part 2 is then going to be your intercalation. So at that point, you will have a graduation ceremony with an honorary BA, which is quite nice. And then you will come back to clinical veterinary medicine. And the feedback I tend to get, so Dr. Hooks will look after you in your first 2 years. You'll then have a different director of studies for your intercalation, and then I'll look after you in your last 3 years. And the feedback I tend to get is people being like, oh, Rachel, I love my intercalation, but you know, I'm so excited to like touch an animal again. I'm so excited to be back on clinics. I'm so excited to feel like I'm working towards being a vet again. And that's really, really nice feedback that we get quite consistently. So the format of our formal teaching is that we have the university course, okay? So you'll get your lectures, practicals, dissections, problem solving exercises, and then you'll have departmental supervisors. But we also will have your college supervisions as well. So that's just a nice little added bonus that we're the only vet school that do these really small group teaching as well. So if you want to feel like you have a little bit more support, a little bit more scaffolding, and a little bit more of clinical insight, then definitely do consider the Cambridge teaching model. So EMSs may or may not be something you guys are sort of familiar with, but extramural studies are a requirement of the Royal College of Veterinary Surgeons. So there is a requirement to do a minimum of 12 weeks through your first 2 years, and then 16 weeks for your clinical years. So basically 8 out of 12 of those need to be based in the UK, and all of your large animal practice needs to be in the UK, and this is a Cambridge requirement now. So for example, farm practice and equine practice typically will be done in the UK. The reason for that is because of different legislation, and because you're going to qualify with a UK vet degree, you sort of need to be more familiar with the UK means of practice. Now, if you have a burning desire to see large animal practice outside of the UK, you can do that. It would just count as your other experience. So normally what people do will be sort of 2 weeks of equine, 2 weeks of something like pig practice, 2 weeks of lambing, which is really, really useful sort of hands-on experience, 2 weeks of cattle practice, typically dairy rather than beef or cattle, and 2 weeks of small animal and whatever else you're interested in, right? So some students are like really dead set on equine, for example, so they'll maybe do 4 weeks of equine. Some people really, really want to be exotics vets, so they'll do 2 weeks in a zoo or 2 weeks at a petting zoo or something like that. Your clinical EMS then is all gonna, so your preclinical is not in events, it's seeing practice. So for example, I was really horsey and I did mine at a riding school because they paid me, and it was really tough financially to be a vet student. So other people, went to my friends went to a wolf sanctuary. I don't know why wolves keep coming up actually in this presentation, but and other students, where I had a student apply to a placement at a deer farm, for example. So there's all sorts of wonderful things that you can pursue if that's where your interests lie. Your clinical EMS, that's okay, Victoria, you can click on. So your clinical EMS can be 26 weeks, so over 3 years. And that does come with a lot of travel and cost implications, which Cambridge and specifically Homerton are really keen to support you through. Okay, so is our course right for you? There is a really strong basic science aspect. So I would say if you are keen on being a vet because you love science and you love anatomy and you love physiology and you love knowing how things should work so that you can put the puzzle together for when they don't work, which is normally when people call a vet, right? Then I would say definitely think about applying here. It is practical, but you will spend a lot of time in lectures, theatres and labs. Now that is fairly ubiquitous across all vet schools. You will have a very lecture heavy course life. We do quite a high volume of regular assessments. Now, a lot of those assessments are formative, which means that basically they don't quote unquote count for anything in terms of your overall degree marks. And a lot of them are just an opportunity to give you feedback. A lot of veterinary educational teaching is around sort of scaffolding a lot of those professional skills. So trying to foster that ability to imagine yourself as a vet. And a lot of that will be receiving feedback, whether from your senior vets, from senior nurse, from clients. So we try to really scaffold that learning process. You'll have loads of regular animal contact with your EMS and also with this practical animal management. So as I said earlier, we have on-site farms and on-site teaching herds that you'll be able to do a lot of very supported and protected learning of those kind of basic husbandry skills. And we do offer very good financial support. You will have really small cohorts, and we do have a hospital on placement. So those are things to consider. And then, you can pursue pretty much most subjects in your third year, depending on whether or not you have sort of a suitable background. So for example, if you'd never studied music before, you wouldn't be able to intercalate in music. But if you had an interest in philosophy and ethics, there's a chance that you could apply to do philosophy and ethics, for example. And you will be integrated into the central university for a lot of your science teaching, and we will do loads and loads of basic science that will hold you in good stead for your whole veterinary career. So thinking about which college is right for you, obviously Victoria and I are enamored with Homerton, but there are loads of colleges and they're all fantastic and they will all offer you different things. So the main thing we want you guys to get away from this subject session is just being aware of all your choices and sort of being empowered to make the decision for what's right for you, because it's such a diverse career, it's such a diverse job. We're all so different, right? And what works for one person might not work for another. So we want you to apply here because you think this is my place, this is where I want to call home, right? So the central teaching is independent of the colleges, as we said earlier. Sometimes there's a bit of variation in entry requirements. Generally, A star 2A is pretty standard. Some colleges are massive, some are smaller, some are women only, some are mature student only, some are postgraduate only. So do have a look where they're all positioned. I mean, Cambridge is very accessible for all the colleges, but those are just things to consider when you are looking at different colleges. So why would you want to come to Homerton, right? So it is new and exciting. I think it's very new and exciting. I'm very, very proud to work here. our principal, Lord Woolley, Simon Woolley, someone who may have heard of. He's very, very keen on promoting like inclusivity, diversity, and just fostering and championing all our students as individuals, and that really trickles through the whole system. You will have an opportunity to shape the future. You will have the opportunity to have exposure to governmental vets to see how policy shaped. We host a vet med soc dinner every year, where, for example, last year our speaker was a very close friend of mine, but she is the head of ophthalmology at the Royal Vet College and did an amazing lecture on decolonising the veterinary curriculum, for example. And that's something that's still very much in its infancy. And a lot of our students came away feeling very inspired and had a very different perspective on, for example, where they wanted to do EMS placements and things like that. And we have a really fabulous fellowship, which I will discuss in the next slide. And we are increasingly co-curricular. Now, a really nice thing about Homerton is we do have the option for 6 years accommodation. You are guaranteed accommodation for your preclinical years on site. And that's just a nice reassurance. Now, if you want to live off site, if you find a really great group of friends in different colleges, you're very welcome to. But what I tend to find my other role here is as a tutor in a pastoral role, which I'll talk about shortly. A lot of my tutees are like, no, all my best friends are in college actually, so I'm going to live here. So I'll talk a little bit about our fellowship and a little bit about the structure of a college. So why Homerton for veterinary? So in the bottom picture there with the glasses is Dr. Hook. So she is a fantastic medical doctor and provides huge support for the basic science content during it. I'm there with the baby seal. So obviously I'm a clinical veterinarian and can provide a lot of insight into the actual realities of working as a vet as well. Beside me there in the purple scrubs is the lovely Dr. Allison, who is a fantastic first opinion general practitioner who works at the university and works at the RSPCA Small Animal Clinic. So she will be your veterinary school clinical supervisor. So you have your directors of studies, myself and Liz, who will offer the sort of academic support. So if you were finding a particular topic very difficult or finding the workload very difficult, for example, it's something you can come and discuss with us and we can support you with sort of study skills, remedial supervisions, things like that. Oh, I've lost our video. But also you'll have Alison as your vet school clinical supervisor. So what Alison will do is basically oversee all those EMS placements, because I appreciate it can sound a bit overwhelming, can't it? It's like you have to come and do a degree and you also have to do these 12 weeks of preclinical, you also have to do these 26 weeks of clinical EMS. And Alison's job as a really experienced sort of on the front line vet is that she will basically provide you with a lot of feedback and a lot of support about, oh, well, actually, you know, your feedback on your small animal practice was that you need to work on your communication skills. So why don't we do a sort of remedial communication skills feedback session and then do some more first opinion practice, things like that. On the right there is Dr. John Phelan, who is our Director of Studies for Philosophy. And this is something that I think is incredibly special about the Cambridge system and about the Homerton system, is that you will have a tutor. So your tutor isn't a vet. They're in no way, shape, or form linked to veterinary. I mean, John is a very keen horse rider, but he's not in any way, shape, or form going to provide you with any sort of academic input. He is there solely to look after your mental well-being and your pastoral support. So I am undergraduate tutor for the geography students, for example, and the music students, archaeology students. So I can provide them with no insight into their course, but they can come to me with any and all problems, from sort of interpersonal sort of relationship issues and financial worries and worries about, you know, study skill support and things like that, rather than direct course queries. So you basically have this three-pronged system of your director of studies to look after you academically, your vet school clinical supervisor to look after all things veterinary, and then your tutor as well, who's going to look after your mental well-being. On the far left there, we have the lovely Dr. Julie Kenyon, who is a virologist. So she is a specialist in like study of viruses. And she's just one example of many, many, many of our absolutely fantastic supervisors who we have. So from this huge sort of interdisciplinary pool of expertise, you'll have subject experts looking after you basically. Okay. So what impresses us about prospective students, basically just that you really want to be here, you really want to do this. It's a tough course. 6 years is a long time to be studying. It's a wonderful time, but it has to be something you want to do. So I really, really encourage you at this stage for you to see some practice, see the realities of the job, do some reading around the subject, see would you enjoy the kind of scientific rigors of it? Do you enjoy what day-to-day practice looks like for a vet? If so, for me, obviously, it's the best job in the world. It's incredible. And I adored my time at vet school and I adore my time teaching here. But it is tough. But my personal view is every course is tough, right? As you get older, you have friends in every walk of life and every possible career avenue, and they all have their difficulties. And what you have to decide is whether you want this enough to go through 6 years of very rigorous study. We want people who are inquiring, people who ask questions, people who think about things, people who are excited by what they're doing, who find it interesting, because at the end of the day, this should be your decision to come here. You should want to come to Homerton, you should want to study veterinary medicine. And that passion for it and that enjoyment of the real hardcore science coupled with the fact you get to look after animals. I mean, for me, it's a no-brainer, right? But it should be something that you really, really want to do. And if it's something you really, really want to do, we will give 100%, all of the entire team here, whether it is the pastoral team, like your tutor, whether it is your director of studies, whether it is your clinical supervisor, whether it is your tutorial supervisors, we will all give our absolute best to support you in your dream. But what we want and need from you as a student is enthusiasm and dedication. So, next slide. So if you're applying, things that we will sort of want you to, the nicest thing for Liz and I last year, Dr. Hook and I, was the amount of students who we interviewed, and then sort of interviewing around like October, November time or December time, and then seeing them here the following October, and they were like, I loved my interview. I thought it was really fun. And that is the best, right? That's how you know you picked a good question. And that's kind of what we want, right? You'll be given a really novel situation. You'll be given something that you're not familiar with. You're not expected to know it at all, at all. It's like, I don't know if any of you are into music at all, but it's like, if you got given something to sight read and you already knew the piece, you're like, I kind of feel like I'm cheating a bit. So it's meant to be something quite novel for you. So please don't feel thrown in any way, shape, or form if you get given something about, biochemistry or maths that feels really unfamiliar. It'll be seeing how you apply knowledge that you probably have to a new situation, and that's all we want to see. How you work through something. Do you enjoy the process? Because we don't want you to have a horrible time here. We want you to have an amazing time here and look back and be like, those were incredible years. So if you enjoy that kind of scientific rigor and you can enjoy and embrace the challenge, then that's the best way to interview, really. So typically A star AA. Most people do 3 sciences. So chemistry, biology, maths, or chemistry, biology, physics are the most common combos. Some people do further maths, some people do all 4 sciences. But if you apply with science subjects and history or English or French or Latin or whatever else you're into, history of art, whatever you're into, please don't feel put off if you're not doing 4 sciences, because it absolutely can be done. So I'm just going to give you guys a little bit of an example sort of practice interview question. the whole point of this is it's not meant to be something you're familiar with. Some of you, if you've done farm and equine practice or, are into sort of foals or repro medicine or anything, will be like, this is easy. But the whole point is actually taken from a previous Viva question. So when we examine the final years, they do like Viva Voce, like a in-person discussion exam. So this is actually a kind of version of that. So I'll chat you through it, but do feel free to write down your own answers and thoughts as we go through, okay? So this is Poppet. She is a 24-hour-old foal. She's a filly, which is a female foal. So she's a little Icelandic. So your problem, what you get called out for is Poppet was found in the field. The owners actually didn't even know their mare was pregnant. They got a little riding school pony for their child, and then had her a couple of months, thought she was just getting a bit fat and came out and they had a new baby foal. So she wasn't planned. She was initially really bright. She stood really quickly. She passed poo. So the first feces passed by neonate is called meconium. She was really dull then. So initially looked great. The kids were all out looking at her and patting her and thinking how cute she was. But she's now dull and she hasn't really been suckling. So the owner's worried and has called the vet, who's you. Congratulations. You have flown through your 6 years at Cambridge and you are now the vet going out to see Poppets. So think about your clinical reasoning, okay? So what is your problem list? Typically when we get presented with a veterinary problem with a patient, it can feel a little bit overwhelming, right? And the same with these interview questions, right? It can feel a little bit like, oh, you've just given me loads of information and I don't know where to start. So what is your problem list? Your problem list is that you have a 24-hour-old foal. That's not a problem. They're allowed to be tiny babies and they're exceptionally cute when they are. But she is dull and she's getting duller and she's not suckling. So that's your main problem list, right? You can also add to that, you have inexperienced owners who weren't prepared and didn't anticipate having a foal. You then need to think, okay, so I've got my problem list. Why is it a problem? So think about why a foal needs to suckle. Think about if any of you are sort of doing your A-level biology and things like that. This may be a bit more familiar to you, but mammalian species are entirely dependent upon their dam, upon their mother. Mummy horse is called a dam. For quite a long time until weaning, until they start introducing grass. They're going to be reliant on that milk, right? So that is their sole source of nutrients. That is their sole source of energy. That is their sole source of fluids. But also in that first suckling, we have something called colostrum. So again, not something I would expect a student to know or be familiar with, but it might be something where you're like, oh, you could bring in that experience of, oh, actually, I did dairy placement and I saw that they left the calves with the mums for the first 24 hours to get the colostrum. So maybe that's relevant. It's that kind of lateral thinking and that pulling together of your clinical reasoning. So next slide. So your initial evaluation. So we've decided what's a problem. We've decided why it's a problem. We're now going to collect a history. So really important thing that you'll gain a lot of experience of during your clinical years is you'll do a lot of sort of what are called directly observed procedures and a lot of OSCEs, which are observed clinical scenario examinations. So those will give you the opportunity. For example, we get in medical actors to pretend to be owners. So you'll have practice delivering bad information, delivering bad news or bad prognoses to owners and things like that before you have to do it in real life, which is very nice. So you'll get experience of taking histories. You'll also see loads of vets taking histories on placement all the time. It's very de jour. And we'll also, in your second year, as supervisor preparing for the veterinary profession, lectures will also talk about different communication models. So your history, you'll want to know history of the mum, the dam. So you'll want to know, was she vaccinated? Is she in good health? Has she had any diarrhea? Has she been kicking the foal away? Is that why it's not suckling? Other aspects of the history, was the foaling okay? Was the birth okay? And how quickly did she stand up? How quickly did she suckle? How quickly did she pass meconium? Those are all really, really routine things. Are there other horses in the herd? Are they out there by themselves? What's the herd dynamic? Is she getting chased away of her foals, of her dogs, of her sheep, of her etc. And then you can move on to your clinical exam. Okay, so have a think about, so if this was an interview at this point, I'd probably say, okay, so you've done that and now you're going to do your clinical exam. What do you know about clinical exams? So again, this might be something where you say, oh, well, actually, when I saw practice, I noticed the vets always took a heart rate and always took a respiratory rate, or that they always took a temperature, or, oh, well, actually, in equine, I have horses myself. I know that it's really important to listen to gut sounds, or, oh, well, when I've seen puppy, I've never seen a foal, but when I saw a puppy in, I noticed that they pressed on the gums. I think that's something to do with hydration, etc., etc. I don't expect you to know how to do a clinical exam, right? But I would expect some degree of sort of first principle thinking. What are we worried about in this foal? We're worried she's dehydrated. Okay, what might happen if she's dehydrated? She might have sunken eyes, she might have a skin tint, she might have a high heart rate. She's dull, she's not well. We want to check her temperature, check she doesn't have a fever, etc. And you also want to check that mum. Okay, so you want to check the mum isn't really unwell. So again, we're going to look at hydration, we're going to look at heart rate, we're going to look at respiratory rate, we're going to look at temperature. What you'd also want to do potentially, and again, this isn't something I'd necessarily expect you to know sort of off the bat, but what I'd also maybe expect you to think about is she actually producing milk? So again, you might say, oh, well, actually, I've seen cattle practice, and I remember like they hand milked some of the cows, and I can't really remember why they did it, but that seemed like a good idea. So, or you can say, actually, do you know what, Rachel, I have absolutely no idea, and what I'd probably do is go to the car to get my stethoscope and phone my boss, and that's also legitimate. So thinking about what tests you might want to do, again, this isn't something that I expect you to know any parameters for, but you might tell me that you want to take a blood sample, for example. So if we go on to the next slide. Amazing. So typically I'll give you a little bit of information in something like an interview question. I'll be like, okay, well, here's what you did. You may not have known that that was what you needed to do, but let's just say you did all these things. And here's your parameters. So again, you would never, ever be expected to know what a normal heart rate is in a foal, right? I wouldn't really even expect some of my final years to know that. This kind of thing you can look up, right? But I would expect you to be able to recognize what's abnormal based on that reference range, right? So we have a heart rate of 120. At that point, you might look at Poppett's results and you might look at normal and say, okay, well, that's high-end normal. But it doesn't necessarily give us any information, right? She's a newborn foal and you smell weird and you look weird and you sound weird and you're putting a stethoscope on her. It's kind of understandable that her heart rate might go up. So that doesn't really tell us that we've got an unwell foal, and certainly doesn't tell us how to fix her. Respiratory rate, again, high end of normal. Could be stress, could be sympathetic drive, could be any host of things other than primary disease. Temperature, bang on in the middle, 38 degrees Celsius. Again, I'd expect you to look at that range and know that that's bang on in the middle. IgG is probably the one that a lot of you will be unfamiliar with. Some of you might have heard of it. So it's a type of immunoglobulin. So immunoglobulin G is what we test to check that they've had adequate colostrum. So you want it to be over 8 grams per litre, and Poppett's is 3. So next slide, please, Victoria. So, we're looking at that, and immediately off the bat, I would expect you to say, okay, well, TPR is okay. High end of normal for some, but that IgG is really low. Okay, it's below half of what we want it to be. At that point, you're super welcome to say to me, do you know what, Rachel, I have no idea what IgG is. And at that point in the interview, I would say, well, it's an immunoglobulin that gets transferred in colostrum, and it's a marker of whether or not your foal is going to get enough passive immunity. So its little immune system doesn't know what it's doing yet. It's totally reliant on the mum. Links back to why I would be interested in whether Poppett's mum was vaccinated, for example. At that point, we may have time, we may have run out of time to have a discussion about, okay, well, how do we fix it? And we may discuss, if it's something you're familiar with, you might discuss, for example, oh, well, I've seen in the past people give, domperidone for milk letdown. That isn't something I would expect you to know, but it might be something that cropped up during your time on placement, which again is why it's important to see placement, to have things to talk about in your interview. And we could talk about, okay, well, you've tried to get her to suckle, but she's not doing it. So what do you want to do? Oh, okay, well, I'd force feed her, maybe pass a tube. And if it's really bad, I'd consider something like a plasma transfusion. And then if we had time, you might discuss other aspects such as how do we foster good bonding, what further supportive care, what's the health of the mare, etc. So a bit of a whistle stop tour for you guys. Hopefully you find that fun. Hopefully you find it interesting. In your interview questions at Homerton anyway, you will have 3 science questions and 1 sort of vet question. So typically you'll have a sort of biochemistry one, a couple of biology or sort of biological mathematics questions, and then I'll always do a more clinical vetty one. So that is just an example of the kind of walkthrough that you'll get. It'll be really supported. It won't just be us sat there and me bombarding you with questions that you don't know the answer to, right? You'll be walked through a scenario that you're not expected to know. So hopefully that has answered some of your questions. Super, super open to any and all questions, as is Victoria. And these are just some of my very cute little patients who we have in at the minute, because we do a lot of seal work. But yeah, super open to any questions you guys have. I hope that was in some way useful for you.
Thank you so much. That was really, really helpful. I mean, I learned a lot. I've been making a couple of notes. I didn't know that a female foal was a filly, and things like that. So that was really, really great. And what a fabulous kind of overview of the course, and also kind of what that means in terms of your life at Cambridge and also at Homerton. So thank you so much for that. As said, please do put any questions that you have in the Q&A as well. So somebody has said, how can we meet you on the open day? I have had a look, and I know that there will be things going on at the vet school on the open day that you do need to book ahead for. So definitely have a look at the kind of vet school website. I'm going to put a link in the chat shortly. But do you know anything more about the open day at all, Rachel?
So the open day is very much sort of to show you around the vet school, show you around there. So that'll be your opportunity to meet our wonderful Alison, who you guys will love because everyone loves Alison. So I won't be at the vet school open day, but certainly we have our Homerton open days, which I always try to attend. Occasionally a sick seal pulls me away, but not physically. But yes, I always try to attend that. You're also very welcome to drop me a message if you have any more questions or anything like that specifically. But yes, would absolutely love to meet you guys. Also, I tend to be here for the Homerton open days, as does Liz. And then we also have recently, about 2 weeks ago, we had our Homerton offer holder day as well, where you're really welcome to come and have a chat and have a look around the accommodation and things. But yeah, I would really encourage you guys, if you can come to the open days, amazing. And if you can come to Homerton itself, have a nosy round, check that you like it. But yeah, would be delighted to meet you all.
Great, fab, yeah. And kind of on that, we have, as you say, got the open days coming up on the 9th and 10th of July. For Cambridge, unlike some other universities, you need to register in advance because there is a kind of limit on how many people can come, just because of the city being packed. But then do come and have a look. As Homerton, we're slightly further out of the centre, but then that also gives us, a really strong student community, and we've got loads of facilities on site, and also lots of students really like that at the end of the day, you can kind of really reset, rest, relax, kind of stop thinking about your studies slightly. But we would absolutely love to have you come to kind of get involved with some of the things that we have for the open day, be it kind of missions talks, tours of the college. We've also got the Homerton Science Escape game in the evening as well during the days as well. So we'd absolutely love to have you as well. The other question that's on here at the moment is, why are you particularly interested in veterinary medicine?
Oh, I love that. I feel like I'm getting interviewed. This is great. So yeah, I won't bore you guys with my life history, but I'd always wanted to be a vet when I was younger. Loved ponies, loved horses, and could never really afford one. So worked at like stud yard, and then basically got a little ex-race horse, who was my world, Teddy. And sadly, he died very suddenly of colic, sort of totally out of the blue, as when I was about 16, and I was like, I never want to be a vet because it was my first experience of seeing that kind of sadness that can kind of like our vet was amazing and he came out and put him to sleep and things, but I was like, oh, I really don't want to do this actually. Like I just want to have horses. I just love them. But working at the stud yard, you're doing loads of sort of holding the mares, looking after the foals, things like that. And I was like, oh no, I do really enjoy this. Actually, I really enjoy the science of it. But I had done like humanities subjects. So I did like Latin, Russian, English, and history, I think. And I was actually going to apply here to do MML, modern and medieval languages. And then it was in literally just when I was doing applications for stuff, I was like, oh no, I really want to be a vet actually. I really want to be a vet. So I took a gap year to do my biology and chemistry A levels. So if that is of any use to any of you, I don't think you need to necessarily to have thought that like I was born knowing I wanted to be a vet, right? One of my best mates from vet school is very much in that camp, right? And she's fantastic, fantastic small animal vet. But she was like, I wanted to be a vet from when I was 4 years old. I don't even think I knew my name at 4 years old, but fair play. So don't feel like it needs to have been your sort of raison d'etre for forever and ever. But my interest in veterinary medicine is I'm very passionate about like animal welfare, and I'm really really passionate about evidence-based medicine, and I want to feel like I'm giving animals the same caliber of care that I would receive as a patient. So that is my biggest drive for being interested in veterinary medicine as an entity is animal welfare, really. And it's what's really nice about working with wildlife, because you see things coming in a state that you would never see a dog or a cat coming in unless you're doing like welfare work or unless it's been hit by a car, right? And you get to make such an immediate impact, such immediate, give them what we call sort of multimodal analgesia, give them like 3 different types of painkillers, all of sort of different classes. And that's amazing to see. Like a little cat, we had a little buzzard come in last night with a broken humerus, and he's doing great. Like he's on a lot of hardcore pain relief and has a bandage, but like he's doing great, and he should be released in about sort of 3 to 4 weeks, something like that. So for me, it's seeing a real life impact that you can make with science coupled with working for the good of animals every day. It's just nothing beats it.
Oh. Someone else has asked, how can we show our enthusiasm in the interview?
Yeah, it's a great question. I would say just like be yourself. Like very, I know that's really corny. So I would say be yourself, because veterinary is exceptionally diverse and there's room for everyone and anyone, and enthusiasm looks very very different in different people, right? So we'll have a huge amount of sort of interest and awareness in things like neurodivergence within the veterinary community. So what enthusiasm might look like to one person looks totally different to someone else, looks totally different to the next. So it's not that we expect you to come in sort of like, oh, yeah, tell me more. It's going to be what you're interested in. So typically I would say being able to talk about cases that you've seen and show that you've engaged with them. Go into a small animal practice and seeing 10 vaccines and knowing what those vaccines are for a kitten or a dog, for example, is great. But being able to be like, oh, but you know what? Like that vet had such a nice communication style, or, they dealt with really difficult dogs in a really nice way. And, or, oh, they dealt with, I saw euthanasia and I really loved how they communicated the options and how they showed sort of, compassion and advice and caregiving, and that sort of extremes of upset of animal ownership. It's showing that you've really engaged with it. It's not that you have to come in sort of bounding through the door or anything like that. It's just showing that you've engaged with what you've seen, you've enjoyed what you've seen, you've maybe read around a bit about what you've seen as well.
Yeah, and to kind of add to that, I've now put kind of a load of links in the chat. I would just recommend just kind of copying them and putting them somewhere else, because for now it might not necessarily be top of your priority list. However, later down the line it could be really useful. One of those links is for some example supercurriculars. So on our website there are all of the subjects that have been kind of divided up, and then you can then click on the veterinary medicine one and it will give you some examples of some places to start. I would kind of stress that these are starting points. Use that to kind of snowball into other things that interest you. For example, that's how lots of academic research and reading happens. We kind of read something and then think, oh, which elements of that interested me, and then kind of maybe read something else related or something kind of opposing, and then use that to find what you're interested in, and then you can both write about it in your application as well as talk about it in your interview as well. Just make sure anything you do put in your application you have actually read, because it can come up in conversation and you don't want to be caught out, although it does happen every year as well. And also thinking about the application stage, I also did lead a webinar a couple of weeks ago about the kind of personal statement and how to write that, and also did give some kind of tips and tricks for kind of finding some work experience and evidence of kind of volunteering and stuff like that. So do check it out, because it might answer some of your other questions as well. The only other question that we've got currently in the chat, if anyone else has got any other questions, is a question which you, if you don't feel comfortable answering, that's absolutely fine. It's about what are your views on animal testing, having your experience of working with animals?
I mean, amazing question. I wish I had 2 hours and maybe a glass of wine to discuss this with. No, I'm joking. Yeah, amazing question. Genuinely very amazing question. It's a really tricky one. And there is a lot of discussion in veterinary medicine around something called compassion fatigue. I don't know if you guys have come across that term. There is a ethicist called Bernard Rollin, Rollin, if you're interested in this as a subject area, who discusses this a lot. And it's this idea that sometimes what you're asked to do professionally might be at odds with your own personal ethic. So an example of that would be in equine practice. Say you go into equine practice because you love horses, you love donkeys, you really want to look after them, and you end up doing a lot of performance work, and you went into it to look after welfare of animals who were suffering, for example, and then you go down a track where you're doing a lot of euthanasia of animals for sort of performance reasons, for example. So that might be an example of moral fatigue and moral fatigue, moral stress. So my own personal views, if you're interested, I'm very happy to share them. A lot of veterinary medicine is what we'd call very utilitarian. So this idea of kind of what's the greatest utility, what action is going to bring the greatest good to the greatest number. And with the sort of 3 R's of animal research, an Animal Welfare Act and Animals and Sciences Act, we fall under a lot of moral obligation, as well as now increasingly sort of what we call deontological, sort of duty ethics and legal pressures and legal ramifications to reduce the number of animals that we use in research. And that is good. And there is, if it's something you're interested in, there is an amazing group called LAVMA, who have a Lab Animal Veterinary Medicine Association, who look after the welfare of animals in research. So from a utilitarian perspective, not a day goes by where you're going to use a drug that hasn't at some point been tested on animals. And that is unfortunate, and it is difficult to know. But for example, if you're using a wormer to worm a horse, I use horses as a lot of my examples because it was my life for so long. But that's been tested on other ponies. That other ponies have been tested for toxic doses to make sure that you are going to give a safe dose to a client's animal. And you have to come to terms with the fact that you're going to be treating animals who are exactly the same as maybe your own dog or cat or horse or pig or pet sheep. But they're exactly the same as them, and that they have just been born into a lab facility, so they have undergone testing and treatment and toxicity testing in order to make that drug safe. And it's something which you'll have to build your own ethical compass around, okay? And it's something that you will have a lot of support in. You'll find, I mean, ethics is kind of my not bread and butter, what's the term? Like the thing I love. So yeah, it's something you will find your own moral compass with. And we will explore a lot about sort of legislation and jurisprudence and things like that. So yeah, it's something I find very difficult. I'll be honest with you. I would find it very difficult to be a lab vet, but I'm also very glad that they exist because they do a lot for protecting welfare of animals in science. But yeah, great question. Absolutely great question.
Great, thank you. Another question has come up saying, would you choose candidates who have won competitions?
I guess it depends what competitions we do it in an incredibly holistic capacity. So, for example, one of the things I really like, and I think one of the reasons I'm so passionate about what I do and about veterinary medicine is that I'm also passionate about a lot of things outside of veterinary medicine, right? So, for example, if you were like, oh, I sprint at county level, or I play in a national youth orchestra, or I go to national youth theatre, or whatever else, or whatever accolades you have as a person and a being, it's not so much about the accolades that you've achieved or competitions you've won. It's more about, do you have things that make you outside of veterinary? Because it's a demanding job, it's a demanding course. And what I love knowing is that my students, might have had a bit of a rubbish day on placement, but that they've got a football match that weekend they're excited for, or a hockey match they're excited for, or, we're going to go to choir later, or we're going to go to orchestra later, or, whatever else makes you, right? So it's not so much about sort of, oh, this person's, incredibly well accomplished at A, B, and C. You don't necessarily have to be good at what you're passionate about. Outside of veterinary, obviously, you have to have a basic professional competence, right? But it's more to do with what makes you in a very holistic capacity.
Yeah, great, absolutely. And then somebody has said, if somebody has applied to Homerton, got an interview, but then not an offer, is it possible to apply to Homerton again with the same personal statement?
I would say if you weren't successful at interview, to sort of reflect on your feedback and things like that, and reflect on why you didn't get an offer, work on that. And then certainly if you still have resolve that, like, this is for me, this is really what I want to do, and then take on board that feedback and sort of integrate it into your revived application. But yeah, you can certainly reapply. I know some vet schools have a kind of like, you apply and then you're not allowed to reapply. I don't know if they still have it, but they had it back in my day. Some of the vet schools did it like that. But yeah, I don't know if you have any other perspective, Victoria. I don't think from an admission point of view that there's any problem with reapplying. I would just say make sure you've taken on board why you didn't get made an offer, and then address that rather than just doing a kind of like copy paste.
Yeah. Great. And then kind of possibly the last question we might have time for is any other tips for the interview? I will also signpost to link number 2. I know I've given loads of links there, but it is our third admissions webinar in August, which is about how to ace interviews and assessments, basically. So kind of that is delivered by admissions tutors, so people who are really kind of well versed in that as well. So kind of go for there as well for some really great tips, but whether you had any others as well from a vet point of view.
I would say, and I know this sounds corny, guys, and I know it sounds nebulous, but I would just say approach it with curiosity. If there's stuff you don't know, just think out loud. Just be like, do you know what? I don't actually know, but maybe it's to do with this thing that I did in biology, or this thing that I did in chemistry. Could that be related? Like, we kind of just want to see how you think and how you approach it and how you cope. with novel information and how you can integrate it. And that's why I mean, that's the nice thing about working on wildlife practice as well. You see so many weird cases, but it kind of have an endless bank of stuff that I'm just like, I really don't think a student will have seen that. And that's not giving a hint that it'll be about wildlife. It's just you'll get asked something on kind of physiology or pathology that you probably won't have seen. So I would say just approach it with curiosity. And I know that, yeah, that doesn't sound particularly helpful, does it? But at the core of it, we want to see that you will enjoy the academic rigors of constantly learning and constantly being sort of challenged academically. Like I said, we want you guys to come here and love it. We want you guys to come here and have a really nice time, rather than you know, finding the whole process so stressful that you're just like, oh, actually, no, I hated that. And I'm a really big believer, like I've so many friends from different vet schools, and there's always this fun thing sort of every year they do like a congress on a sports weekend called AVS, Association of Vet Students, and it's all different vet schools to get together at one vet school for a weekend. And it's lovely meeting everyone from different places and hearing their experiences. And if Cambridge isn't for you, if Homerton isn't for you, there will be another vet school that you love and that suits you and that fits you. And I'm not going to sit here and be like, definitely come to Cambridge because Cambridge is the only good vet school. But if from everything sort of Victoria and I've said today, and your understanding of Cambridge is that actually, yeah, I would love to go there and I would really enjoy it, just bring enthusiasm, see placement, do see placement, because although we don't have as high a requirement on paper as that it may have changed now, but I remember when I applied to Liverpool, it was like 10 weeks, I think, of placement that you just had to do. You just had to have had that before they like read your personal statement and things. So do see placement, because that will give you an idea about like, is this for me? At the end of the day, all I want from my students is to know that like they're looking forward to becoming a member of a profession. So
yeah, great, absolutely. And kind of reiterating that don't be disheartened if, you know, as you say, you're being presented with unfamiliar things, and, you know, just because you don't know the answer doesn't mean interview over, you know, that's kind of the end of the road for you. You know, as you say, think out loud, kind of say, I'm actually not sure on this one. Interviewers are there to kind of prompt you. They've been in your position in the past, and also, you know, they are there testing that flexibility of thought as well. So you might get an answer and you might say something that's really, really great, but they also might counter it with a different avenue. Well, have you considered this? That doesn't mean that your first answer wasn't really, really valid. It's just a case of they're wanting to see how you respond in those situations. Yeah, that curiosity, flexibility of thought, and so on. And great. So I think that's all we have time for. There is one question that's just popped up about problem solving, but I do think that's kind of also been covered as well in that just recent answer. I also want to kind of flag the final link in the chat. This popped up on my Instagram earlier from the main Homerton page, which is a fab video, very heartwarming. If you want to see some seals and some of the fab work that Rachel does outside of her teaching at the university, then do have a look at that as well. So yeah, so thank you so much for coming, everybody, and thank you very, very much to Dr. Rachael McKinney for delivering this session. It's been really fabulous.
Yeah, honestly, pleasure, guys. I really hope to meet you guys in future, but very, very best of luck. Like if you decide veterinary isn't for you, then best of luck with whatever avenue, but hopefully, yeah, see you all at graduation in 7 years.
Thank you very much.
Bye.
Thanks.